Hello, I'm Dr. Sollazzo. Um, I'm going to talk about a very important subject that is as simple as it sounds, whether or not to remove a tumor or leave it in your body. Some people will immediately say, why leave it in? There's a lot on the internet and in books that can be what we call misinformation, oversimplification. And on the internet, they say that if you remove the tumor, you might spread the cancer. So that obviously is one way of looking at it. The other way of looking at it is if you have a mass, there are hundreds of thousands, if not millions of cancer cells within the mass. If it's in your breast, if it's in your lung. And if you leave those many cancer cells there, they can move on and seed your body, and now instead of being stage 1, you're stage 4. Stage 4 cancer, colon, breast, prostate, pancreatic, are not curable. Eventually it does you in. So you do not want to be stage 4 cancer. So cells can jump into a blood vessel, a lymphatic channel, a neural sheath, and seed your body. For instance, the breast drains out here first, the lymph nodes. That's why the doctors will remove the sentinel lymph node, the closest to the breast. They no longer remove multiple lymph nodes unless needed. If the sentinel lymph node is negative, they won't proceed. So the point is, leaving a tumor in your body can cost you your life. The cells can jump ship, seed your body. A skilled oncology surgeon wants clear margins around the tumor. They don't want to go near the tumor. They want to get it all out and no cancer cells near the margin to ensure cure. Surgeons have a cliche, cut for cure, whatever. The point is, if you can remove the tumor, it's the safest thing to do, and you can do other things to prevent it from coming back. So I want to show you some things, mistakes people make. They refuse to remove it. They do many alternative things. Lots of it is good, but many times it does not work, and it costs the patient their life. So I'm going to show you some pictures, and I hope you can see it on this video. This is a breast, and as you can see, the tumor has come out, and now there's pus in the middle of the tumor. And it is not operable anymore. The surgeon cannot remove this mass because it's huge, it's fixed to the skin, and you can't close it. You can't get a closure. This is a breast. It is total tumor. Total tumor. I had a patient that had breast cancer, and the tumor was so big, the whole breast was black, it was malodorous. She would put charcoal on the breast to absorb the smell. I'm going to try to show you this. This patient had skin cancer, only wanted to do natural things. He has holes in his face. Again, not operable. Cannot close it up. He is no longer with us. This patient, very well-to-do, educated. She was diagnosed base of the tongue cancer, stage 1. The surgeon told her, I can remove it. You won't need further surgery. You won't need radiation. You won't need chemo. She refused it. Came here about 5 months later, and the tumor now grew stage 4. Look at that. So You don't want to go there. You don't want to be that. So now she still refused treatment. I told her that the tumor could grow and invade the carotid artery, the jugular vein, and she can bleed to death. 3 or 4 months later, she came back and it got worse. The thing grew and other tumors came out. I don't know if you can see that, I hope. So you don't want to let this thing get out of hand. You need to remove it and do alternative things as well. Whether it's supplements, herbals, fasting, high dose vitamin C, whatever you choose to do, no sugar, again, specific supplements, diet, looking at inflammation, looking at many things that might be the cause of your cancer. The cure is in the cause. The cure is in the cause. So you want to get at the root cause and stop it so it doesn't reoccur. And there are many things that decrease reoccurrence, including exercise. Behind me there's a book, the American Society of Clinical Oncology, just about a year or two old. Under the breast cancer chapter, under lifestyle change, it says, women that had breast cancer, they removed the tumor. If they exercise regularly, decreases reoccurrence 40 to 67%. 40 to 67% exercise. What galls me, my colleagues, other oncologists don't talk to their patients about diet, don't talk to them about exercise, and mini fasting has been shown also to prevent reoccurrence of cancer in a very big way. So there's many things you can do, but you should remove the tumor while it's operable. It can cost your life not responding to it quickly. I can show you more and more pictures. This patient has a sarcoma, and they refused to operate, and it's out of hand. Nice guy, and it's tough decisions. Sometimes they would have had to remove his arm. That's a tough decision, and it was his right arm. But usually it's not quite that tough of a decision. In any event, you have to, cancer is the devil himself. You can't hope it away. Hope does not have a plan. You have to have a plan of action. You want to remove the tumor, change your lifestyle, diet, exercise, again, supplements, herbals, mini fasting, and many other things. And on top of that, it's not one or the other. So you want to be smart and not come in harm's way. If you have any questions, you can call us 631-361-6160. Again, 631-361-6160. If there's any subjects you want us to talk about, I'd be more than happy to do another short clip video. Thank you.